Thank you, Chairman Peterson, Suzanne, for the invitation. I hope I'm projecting well enough. But first of all, how much time do I have so I can make sure to?
About a half hour.
About half hour. Okay, great. That's perfect. So as mentioned, my name is Kim Russell, and I've been a part of my agency for about going on 9 years. I work for state government, and my focus is really working in healthcare, health and healthcare. It's interesting to provide this presentation because I think we're defining health a lot more broad, right? Especially with COVID. I'm really happy that we're doing that. And so I think that's one thing that the COVID has allowed us to do is to work in spaces that we don't normally define as health. So for instance, before I get into the presentation, we are working with the Department of Health Services to implement a component of the Arizona Health Improvement Plan. And I said that I'm going to do this. We're not going to do this by ourselves. We're going to work with our other sister state agencies like Access and ADHS, and DES, and First Things First to implement this section of the Arizona Health Improvement Plan. So I presented the scope of work to the tribal liaisons, and they were all in agreement of what we could kind of be working in. But I asked them, is there anything else you would like to work in? And they said, you know, Kim, we heard a lot about housing and homelessness throughout COVID. Is there something we can do in that space? And, you know, we're all kind of health kind of focused. DES kind of works more, you know, broadly. But I was like, yeah, what could we do in that housing space? Because, you know, I don't work mostly in housing. Mine is more Medicaid policy and public health kind of policy. So we brainstormed, and knowing that from where we are within our different state health departments or our state agencies, knowing that that's not kind of our expert area, but we want to try to venture into that. Let's start with a housing assessment. So that's something that we're going to be doing through the Arizona Health Improvement Plan collectively across 5 state agencies, is to put together a housing assessment for our indigenous populations here in Arizona. The details to that is still to come, but I'm really excited as to what that could look like for that 5 agency MOU that we'll be going into. And again, I'm excited because I don't really talk about housing in the work that I do, but we hear it all the time. So I'm really excited, and I'm excited because a lot of what I do is policy development. And how can we weigh in on that from our slant as health, you know, gurus and healthcare policymakers? How can we be a part of that conversation? So anyway, so just wanted to kind of give you a little bit of the conversations I've been having with the stakeholders that I work with, and the reason why we want to maybe come at it with a more of a healthcare slant is, you know, we don't normally work with housing directors in our capacity. We mostly work with tribal health directors and urban Indian health directors and health service directors. So I think the way that we're going to approach this assessment is we're going to go ahead and already work with those partners that we already have in place, but ask them those questions around housing. And then lastly, before I go to the wheel here, I just wanted to provide that example because it really relates to the wheel. I let my staff know that when we talk about housing and homelessness, that they can be two separate things. So we need to be very aware that homelessness and housing could be separate, but then also the same, that they could touch, right? So we want to make sure that as we approach this housing assessment, that we're mindful of that other kind of homelessness conversation over here, but it does kind of look different in tribal communities. And to explain that point, I remember a tribal leader saying sometimes we do ourselves a disservice as tribal people, because when people ask us, what is the plight of your homelessness on your reservation in your tribal community? And they'll say, we don't have a homelessness issue. Because culturally, we're going to take everybody in. Now we take them all in, their family, they will have a home. So from our viewpoint, because we take care of our own, we take care of our family, they have a home. But really, it's not a permanent home, right? So sometimes the way that we talk about it in tribal communities is going to look a little bit different when we talk about housing and homelessness. But anyway, just wanted to give you some news from the agency that I'm a part of and the partners that we'll be working with in this space of housing and how it kind of relates to homelessness, and you just see what's happening in terms of housing and how it impacts our health and healthcare system. So more to come on that. And of course, it really relates to the wheel. I know that you all are very familiar with the wheel. Just to kind of give you a little bit of background, I've known Suzanne for a number of years, and I think it was Mr. Michael Allison, who was the former ADHS tribal liaison who brought us together with Suzanne and Alita Montiel to talk about the tribal wheel. So I think we might go into that first slide here.
And Kim, just to the Arizona Health Improvement Plan has their SDOH committee, and that committee is focusing on housing, and Gabe is co-chairing that. So,
And we know Gabe.
yeah.
It's good. It's who you know, right? Making
Yeah.
those partnerships. So awesome. So a little bit about, I guess maybe a little bit of the history of the wheel. You know, Suzanne came to us and asked us, could we put something together that reflects tribal communities and our way of, you know, looking at what a healthy tribal community looks like. And when I say healthy tribal community, that can be urban based, that can be tribally based. It's really an Indian Indian community, right? Because we know our tribal populations are across the whole state, across the whole nation, both reservation based and non-reservation based. City, rural, we have a lot of border towns as well that have a high population of American Indians in our state. So where we're talking about, you know, across the state, when we talk about what does a healthy tribal community look like? And of course, our communities are all different. We have some communities that are like 99% American Indian, and then we have some communities that maybe are half and half, or we have a community just right out here where it's Salt River, Pima, and Maricopa, so two different tribes. So we're really looking at a healthy tribal community, and again, going back to being introduced to Suzanne to kind of discuss what would it look like for tribes. And I remember Michael Allison, and then feel free to join in, Suzanne, but Michael looked at the wheel that was presented by Suzanne, and he pretty much said, we already have this philosophy in place. As in,
Right, you just got the wheel right. That's what
that concept as Indian people, we already have. I guess maybe it's just because we already kind of think collectively. Yeah, it's innate for me to think collectively, right? That sometimes policies and other views of the world, when it's very individualistic, it doesn't make sense to me. But that's the world we live in, and so we have to, you know, figure out how that looks like. So anyway, it was Michael Allison who was just saying, you know, Suzanne, we already think this way. It's just that you guys put it down in black and white and it looks really nice. And we appreciate you putting it down like that, but we think this already. And actually there's some tribal communities and people who have also put it down in black and white as well. And that they have their own types of, I guess, paradigms that they use for their programming and planning already. So when we started to go down this path, we realized we needed to pull in a really important partner in a tribal council of Arizona who could help us do this work as well. And so that's where Alita Montiel came in, and she helped us get that started and really reach out to the tribes to get their input in it. So we decided to go into this partnership with Suzanne, provided with a little bit of funding. ITCA was able to pull together tribes to take a look at the wheel that was created by Vitalyst Foundation, and then ask them, does this resonate with you all tribes? And I believe we had over 17, I think, tribes, representatives from over 17 tribes participate. I think 3 or 4 of these meetings where we brought them together to ask them, does this wheel make sense for you? For the most part, yes. The wheel, I don't think there was anything we took away from the wheel, right? Suzanne, we didn't take anything away from the original wheel. We just added to the wheel. And so that's what you see before you. It looks probably very familiar to you already. We just added some pieces to the wheel. And so anyway, that's just a little bit of the background and how we got to working with Vitalyst Foundation to create the tribal wheel. And I'm a huge proponent of the tribal wheel because it justifies my work into these other spaces, right? Like I talked about how excited I'm about to how we're going into the housing space. It justifies my work as well. And then of course, then it filters down through my agency and it justifies my staff to think more broad. So totally endorse the tribal wheel concept. Again, we just worked with the tribes to develop the wheel, had them take a look at it. You can go to the next slide. So I don't think this definition is any different than anybody else's, right? Doesn't matter where you're from or who you're a part of, but the way that we defined a healthy tribal community was a tribal community is one where families have the opportunity to live in balance from birth to an elderly age, within environments that are clean, safe, and promote wellness. And then a tribal perspective is that one's health is influenced by cultural and environmental knowledge that sustain tribal communities prior to colonization that may be adapted to influence our quality of life. And then lastly, these factors stem from overarching values that have continued to influence individual wellness and tribal communities. So that was the feedback that we got back from our meetings with the tribe. And this is the kind of the definition that we came. Again, I don't think it's very different from other communities. Maybe a little bit more emphasis on some cultural pieces and environmental, but that's how we've kind of defined that tribal healthy community through those focus groups. Next slide. In doing the focus groups, we realized that the comments we were getting back kind of fell in these different areas: beliefs and spirituality, resiliency, way of life, self-determination, and then the last one, sovereignty and tribal governance. These four principles aren't in the original field, but this is what came out of the conversations we had with our tribes. And I think it's really important to note this because when you're working with tribes, this is what we're thinking about as well, right? When you have conversations with tribes about anything that you're wanting to work with them on, you have to consider self-determination. You know, the right to self-determine their own lives and their own policies, because that wasn't always something we had control of, right? So we really hold true to being able to self-determine our own lives. Whenever you talk to tribes about housing or healthcare policy or whatever it is that you're working with them, sovereignty and tribal governance is always going to be a part of that conversation. And how are you equipped to be prepared to work to have that conversation with them, right? It is in some ways a little bit a different language. I think like, does anybody know what 638 means? Right, in our language, 638 is really reference to Public Law 93 638, which is the law that allows self-determination, right? So yeah, so we have a different language that we speak, and just becoming equipped to be in that conversation, because you know these are a little bit different for tribal communities. Beliefs, spiritual knowledge, just things that we've considered true based on traditional cultural practices. Just to kind of give you an example of this, working in the Medicaid space, we've worked with our access team to have them reimbursed for traditional services. Services that our medicine people provide. Now, we didn't build that system, right? But it's our medicine. And we'd like for this, the Medicaid program to reimburse for our medicine, our traditional cultural practices that we've had forever. So we're working on that. And then resiliency, way of life. I think if anything that was really demonstrated through COVID, we've had other instances where throughout our tribe's history where we had to be very resilient people. And we still are. Okay. And I think for the rest of this presentation, what you already know. So social determinants of health, these are the different, I always call it the pieces of the pie, the pizza pie, right? The social determinants of health, they're all here. They're part of the wheel that was originally created through Vitalyst. Go to the next slide. And here is the wheel. You'll notice the pizza pieces, right, of the social determinants of health and the light green, and then the different principles there. Just to note, when we were putting this wheel together, we wanted to make sure that there was, the people around. They're supposed to demonstrate both men and women, children there. I wanted to also mention that if I were to put the wheel together, this is for me, I'd have animals in there. Because for my people, we really regard animals highly in the work that our community. But again, this is just something collectively that the tribes put together. I did see a wheel come from, I'm gonna say, I think Canada. They had animals because that's what they feel represents a healthy tribal community because of that close connection with animals. So this wheel is just
in the medicine wheel.
In the medicine wheel. So this wheel is just, collective of the multiple tribes here. When we present the wheel to tribes, we let them know that you probably already have this available to you, your own concepts that you've had since birth. But here it is in a really nice, pretty format. Feel free to add to it as you best see fit. But I think it contains things that we all can agree to, right? Like land use or social justice or housing. It's really difficult to talk about a healthy tribal community if you're not talking about the economy or education or these other pieces. And so again, it just allows me and the work that I do to, how can I truly talk about a healthy tribal community and build a healthy tribal community and make policies for a healthy tribal community if I can't talk about social cohesion, right? We need to have those conversations and we need to be in that space too. So, and I don't know if I have any more slides here. Again, this is just
Kim,
more.
that's the first time I've seen it like that, and I'm thinking about the new Suns logo. They have the people around, they have 22 that represent the 22 tribes.
Oh, wow.
So it'd be kind of fun to, I don't know if you probably wouldn't want to modify it, but it looks very similar, but you have the 22 people representing the 22 tribes and the new Suns. What do they call it? The community logo, their jerseys, their new community jerseys. Yeah, tribal jerseys.
And then this just kind of goes deeper into the different parts here. Next slide. Again, some more into the different and these the pillars don't necessarily just correlate to these three. It's just how we kind of put it together. So if you saw the wheel, you need to imagine that the wheel is turning. It's not static. It turns. Okay, next.
And we've animated it, it's just not in all of the presentations, but I think on the website, Sergio worked with someone to get it where it's animated. So it shows, because it's more powerful and it really resonates and talks about how important it is that you can't just think of it in a static manner. You need to think of the interaction.
The next slide. And and then next slide. Okay, so again, I mentioned the key. I was an advisor to the development of the wheel as well as Michael Allison, and of course we appreciate the 17 the people in 17 tribes that came to help us develop the wheel. Next slide. And just more contact information with ITCA and Vitalyst. I think that might be it, but that is my presentation on the tribe wheel. I've done this presentation a number of times.
American or Indian Health National Conference.